The topic I'll be talking about is how and why diagnosing diabetes differs in pregnant women compared to non-pregnant women. This topic is difficult to understand as pregnancy affects a woman's ability to metabolize glucose. Due to this, diagnosing diabetes in pregnant women is difficult as various factors must be taken into consideration. One of the main reasons for this is that the placenta produces various hormones such as human placental lactogen (HPL) and human placental growth hormone (HPGH), which flow into the mother, thus increasing her resistance to insulin. Due to this insulin resistance, the body is unable to take up glucose efficiently, which reduces glucose metabolism and increases the risk of hyperglycemia and the development of diabetes. Therefore, the interplay between insulin resistance, placental hormones, and overall glucose metabolism makes diagnosing diabetes during pregnancy very difficult to comprehend. Diagnosing diabetes in pregnant women is very important for both the health of the mother and the child, and if not properly diagnosed, several risks are posed. One study showed that excess glucose from the mother due to hyperglycemia can be transferred to the placenta, which can result in an overgrown fetus known as macrosomia, birth trauma, neonatal hypoglycemia, and erythrocytosis. Additionally, another study showed that the mother becomes susceptible to preeclampsia, high blood pressure, and increased protein levels in the urine. The mother also becomes more likely to require a C-section delivery due to the aforementioned macrosomia risk. Women who develop gestational diabetes are also more susceptible to developing type 2 diabetes later in life, so accurate diagnosis during pregnancy can help them be aware, allowing them to take preventative measures as they age to minimize the onset of type 2 diabetes. Some of these results can be seen in the table on the right, which shows the percentages of these outcomes in treated gestational diabetic and untreated gestational diabetic patients. For example, we see the macrosomia level in the second row at 92% in untreated, whereas it's 78% in treated. Therefore, having a different set of criteria and testing thresholds for diabetes diagnosis is critical, so that pregnant women can be treated to mitigate the negative effects diabetes may otherwise have on the birthing process, the health of the mother, and the health of the fetus. Clinical biochemistry plays a crucial role in understanding the exact mechanisms that cause gestational diabetes, enabling the development of targeted diagnostic analyses and treatments for the patient, thereby preventing potential issues from arising. As such, knowing that the placental hormones HPL and HPGH released from the placenta to the mother cause insulin resistance allows biochemists to analyze glucose levels and change the criteria for diagnosing diabetes in clinical tests. For example, the OGTT in pregnant women is held to a different diagnostic standard with a threshold of greater than or equal to 10.0 millimoles per liter for diabetes and 6.1 to 9.9 millimoles per liter for prediabetes. While this test can be used to assess diabetes in pregnant women, other tests must also have their standard values adjusted to account for the effect of pregnancy on insulin resistance. One test specific to pregnant women is the glucose challenge test, which the subject ingests 50 grams of glucose without fasting, and glucose levels are measured an hour later. Levels above 11.1 millimoles per liter are diagnostic for gestational diabetes. Once a proper diagnosis is identified, proper treatment can begin, such as regularly monitoring glucose levels, adjusting insulin dosages, and making changes to dietary intake. These will help prevent several issues from arising in the child, such as macrosomia and neonatal hypoglycemia, as well as complications from arising in the mother, such as preeclampsia and high blood pressure. Overall, clinical biochemistry helps not only diagnose but to assess treatment plans for patients to avoid health risks. Pregnant women have a different set of criteria when it comes to their diagnosis of diabetes compared to non-pregnant women. This is because the developing child produces several substances which can cross into the mother, which reduces her resistance to the hormone insulin. Insulin normally regulates blood sugar levels by signaling cells to take more of it inside. However, an increased resistance to this can lead to less sugar being taken up and thus more floating around in the blood. This means that they are higher risk of increased blood sugar levels known as hyperglycemia. Not diagnosing this properly can lead to several complications such as fetal overgrowth, which may lead to birthing complications as well as hyperglycemia and high blood pressure in the mother. Due to this, biochemists have altered the thresholds of several clinical tests to account for the change in regular sugar breakdown in pregnant women. Once these tests are used to make the accurate diagnoses, further treatment for these patients such as changes in diet and insulin administration may help prevent worsening symptoms. For this assignment, the AI tool ChatGPT was used to help improve my thinking. This was because I used it to help summarize information from the primary articles I found so that I could clarify any information before I use it, such as the information regarding the negative effects that improper diabetes diagnosis can have on the fetus and the mother. Additionally, I use it to help brainstorm how to clearly re-explain the topic to make it simple for a non-professional to understand and edit it to flow in the order in which I presented the information. Thank you for listening to my presentation, and here's a reference list of all the resources that I used.